Spotlight, presented by Community Health Network.
Welcome back. When someone with dementia is in need of extra help and support, a caregiver usually steps in. According to the CDC, 80% of the time, it's a loved one giving that care inside their own home.
Yeah, and doctors say taking on that role is really hard work, stressful, and can even lead to their own health issues. But in today's Health Spotlight, News 8's Brittany Noble shows us a new app that is giving those caregivers the tools they need and a reminder to take care of themselves as well.
I'm gonna give him a nice kiss.
Dennis and Sheila Huntington have been married for 53 years.
She always tells me how she likes having me around, right there.
I do.
Dennis spent decades as a minister. When it was time to retire, he felt called to do something else.
Found out they need caregivers in homes for the elderly and thought maybe that's what I could do and enjoy.
He spent about 10 years doing that. Then Sheila was diagnosed with dementia, and now he's a caregiver in his own home.
The caregiver is what we call the invisible patient.
Professor Richard Holden and a team of many others have developed an app to help caregivers just like Dennis. It's called Brain Care Notes. Caregivers fill out a clinical evaluation. Then, care notes are provided based on that assessment. Then, a care coach works directly with the caregiver.
We assess the caregiver just like we do the care recipient. We want to know their stress levels. We want them to track it over time. And the coach spends a lot of their time managing the care of the caregiver.
One priority is making sure the caregiver takes a break to focus on something they enjoy.
You need, as a caregiver, to be able to relax somewhat, or it can overcome you.
Dennis tries to spend about an hour a day woodworking. He also finds it helpful to talk to other caregivers. And even on the tough days, he knows the most important thing is
Let them know that love's there.
I'm Brittany Noble reporting for Wish TV, wishtv.com, or follow us on Facebook for updates.
A good message there. That professor you heard from says the Brain Care Notes app is currently being used to study by participants. He and his team are working to develop more features. They don't exactly know when yet it will be available to the general public or what it will cost, but they do say they hope to get health insurance companies to on board to cover that cost.